Even tone, no spots, no redness. You know exactly the skin I'm talking about. Smooth to the touch, firm in a way that looks effortless. You've seen it on a baby, on a teenager, on a woman across the room whose age you simply cannot place. It exists on every skin color, every background, every age. And today we're going to learn exactly which treatment stands between you and that skin. But first, we have to learn about three things from Dr. Sarah Yovino: tone, texture, and tightness. Dr. Yovino, when a patient sits down with you and describes what they see in the mirror, what do they usually say first?
Well, the first thing that most people say when they're coming in for any kind of rejuvenation procedure is, I feel old. That's like the number one thing. Like, I need a zhuzh. I just feel like something, I don't know. I just like I've aged all of a sudden. Those are the most common things that really I see and I hear from my patients. And usually what I'll do is I'll hand them a mirror and then I'll say, well, try to get some clarification. Like, well, what are you seeing? What makes you feel old? And we kind of go from there.
That makes sense. I feel old. I get that.
Yeah.
I grew up in the sun, and we back in my day, we used to put baby oil all over our face and chest and skin. And I've got the spots to prove it. So on a scale of 1 to 10, how fixable are brown, sun damage and age spots from someone who's been living with them for years?
I'd say probably around a 7. It depends on what the spots are. So if there are spots that are due to melasma, that's much tougher to get rid of. And that is not just do a procedure, get rid of it, and you're good for life. That is a lot of upkeep to not have that happen again. If it is just simple, what we call lentigines, which is just sunspots, those are fairly easy to get rid of depending on the device, whether it's IPL or CO2 laser, but they can, you can get rid of them and then you can maintain and try to keep them at bay.
We are so happy to welcome Dr. Sarah Yovino, a double board certified anesthesiologist and pain specialist who's been in practice for nearly 20 years. She's taken her history of injecting Botox to injecting for aesthetic beautification. Dr. Yovino, welcome to Beauty Seek.
Thank you. Thanks for having me.
Absolutely. We're happy to have you. My sister-in-law and her brother have what I've been told is called a pregnancy mask. What is that? And on a scale of 1 to 10, how fixable is that?
So that is melasma. Melasma is what is coined the mask of pregnancy. Like I said, it's most commonly seen on the forehead, cheeks, upper lip. As far as your sister-in-law goes, for her, it's fairly easy to get rid of if it is due to the pregnancy, because typically after the hormones readjust and get back to normal, the melasma most often will clear up. So I'd say maybe a 7 out of 10 to get rid of it.
Oh, wow.
Male that has melasma is going to be much more difficult to get rid of. Or if you're female and it's stubborn melasma that does not go away after the hormones readjust. If that's the case, then, it's going to be a lot of, topical stuff, medication, whether it's medication, whether it's energy-based devices, microneedling, and then maintenance with retinols and sunblock and all kinds of things. The best thing is you try to prevent it from happening in the first place. Like, you're pregnant, you need to wear sunblock and you need to protect yourself.
Okay. And he would sit out in the sun a lot and it would just get darker. And that's what happened to it.
Yeah.
I'm experiencing the opposite. Some of my skin, where all that baby oil used to be, it's almost lost its color entirely. I have like little white spots on my arms and legs. They're pure white. So on a scale of 1 to 10, how easy is it to return white spots to normal skin color?
Well, that one's a lot more difficult. I'd say that's probably a 4 out of 10. And even the energy based devices that you use, such as IPL, it doesn't necessarily bring the color back in the white spots. What it will do is it will make the surrounding tissue not have so much of a contrast to the white spots. So it allows them to blend a little bit better. But if, some people go as far as even medical grade tattooing and tattooing pigment back into the white spots. But it is an ongoing process. It's like 3 or 4 procedures to get it to the right tone. So it's not that one, there's no real great way of getting rid of it 100%.
Did you say IPL?
Yes.
What is that procedure like?
IPL is a very easy procedure to undergo. It's called intense pulse light. And what it does is it gives a flash of light, and that flash of light, depending on the filter that's placed on the machine, will penetrate at a certain depth and target certain tissue. So the easiest way to think about it, it's really good for reds and browns. So if you have a lot of broken fine capillaries, if you have, red spots or brown spots from sun damage, women get it often on their chest, on their arms, on their face. If that's the case, then IPL is a great alternative. It's typically done in a series of 3 to get all those little spots off.
You're really good at segues. I don't think I have this myself, but I definitely see men, especially in their noses, with redness, almost like I can see their capillaries. On a scale of 1 to 10, how addressable is that kind of redness?
If it's a capillary that you can see, it's very easy. Whether it's like zapped with a little, device, whether it's CO2, plasma pen, something else. A lot of times it's very easy to get rid of those things. IPL will shrink the capillaries down. It all depends.
You mentioned something before this interview that I had never heard of, a natural pink that lives under the skin when we're young, something to do with blood vessels that fade as we age. On a scale of 1 to 10, how much of that beautiful pink can you get to return to an older complexion?
Well, that's fairly easy with certain procedures that are known to stimulate angiogenesis. And angiogenesis is new blood vessel growth. So there are, like CO2 laser where you're getting rid of the dead skin and you're penetrating these like vaporized channels in the skin to stimulate new collagen and new blood vessel growth. So what I was saying before was, as we age, we start to feel like our skin looks a little dusky and not as like vibrant as somebody who's much younger. When you look at like a baby, or you look at even like an 18-year-old who's got nice, smooth, flawless skin, and the skin is nice and pink and plump. And then as we age, we lose a lot of that hydration. We lose a lot of that color. We add color, ones that we don't want to add. We add wrinkles and textural issues. This is something that with different procedures and constant upkeep, you can keep at bay and make your skin look more youthful.
Wow.
I don't know if that answered the question. Did that answer the question?
Yeah, no, it's just amazing. So basically you're kind of regenerating deep inside and kind of getting that pink back. Cause I know what you're talking about with that gray. I almost think like an elderly gentleman who smoked a lot and is inside and never gets outside kind of just feels gray. Wow. So how does somebody know? Like, can you look at yourself and you can know, or you're so skilled, when they come in, oh gosh, they've kind of got that gray and I need to work on.
Well, I just mean in overall, in general, if somebody's not looking super healthy or they're just looking a little bit like, when they say, I feel like I look old, I mean, that's typically part of the whole overall look, whether it's like, whatever may also contribute to it, but that adds to it. So procedures like microneedling could be great at rejuvenating that and bringing in new blood vessel growth, increasing collagen and elastin, and making the person feel a lot younger and making the skin look younger.
I love that. I love that that's a possibility. And we were talking about that before our interview, that you mentioned you've got a lot of patients in their 50s who come in and they're all dotted up. And when you address their skin tone, like what does that feel like when they look at themselves and see what you've done for them?
after we're all finished with whatever we're doing, I mean, they're very, very happy. It's a very rewarding feeling for me to be able to make someone feel like themselves again, or make them feel like they're young, like feel younger. And a lot of times you feel like, wow, I still feel like I'm in my 20s, or I still feel like a teenager, but your body doesn't match that. And sometimes there's just like a weird disconnect, especially as we age. We're like, can't believe how old I am, and to make someone feel like they look like they feel, or they look like they, feel inside in their head, it's a very rewarding feeling.
Thank you so much for being with us today. This has been
You're
an
welcome.
amazing education. Beauty seekers, thank you, not just for watching, for being part of a community that believes you deserve proper education so you can make the best aesthetic decisions for you. Every new subscriber is a point of proof to us to stay focused on our mission to bring beauty seekers like me and you aesthetic education from doctors like Sarah Yovino. The more educated we are, the better aesthetic results we like to get. All right.
That's true. And thank you for having me on your show.
Absolutely. It's been a pleasure.
You're welcome.
We're getting closer to learning the treatment plan that can bring you closer to that soft, smooth, creamy baby skin. But first, let's learn about skin texture and how Dr. Yovino treats facial scars. It's amazing.